Hi everyone, it's Dr. Rosi. Welcome back to my YouTube channel. I'm going to be speaking to you today about eczema or atopic dermatitis, just a fancy word for eczema, and more specifically, how do we treat it in children? If you're new to my channel, the purpose of my page is to help educate and inspire you to live your best life. So if this is something you're interested in and don't want to miss out on, please consider subscribing to my channel and liking this video so you don't miss any future videos on this topic. Now, for the purpose of today's video, we're going to be answering the following questions. Number one, who gets atopic dermatitis or eczema? And we'll just say eczema for simplicity's sake for the rest of the video. What are the causes of eczema? How does it present itself? And most importantly, how do we treat it? Now, although this video is geared towards treatment in children, most of the treatment options anyway are valid for adults as well. So stay to the end of the video. I'm going to be linking also in my description the most common moisturizers that I suggest for children and or adults in order to help treat their eczema. Let's get right into it. Let's not waste any more time. What is eczema? Eczema is basically the most common inflammatory skin condition in the world, and it is a dry, itchy rash which presents in different parts of our body. Who is most likely to get eczema? People with something called atopy. Atopy is basically like a triad of these three things. Asthma, if you know what asthma is. Number two is allergic rhinitis or hay fever. People who tend to have allergies have this, and inflammation of their sinuses. That's itchy, red, swollen, often needs intranasal sprays or treatments. And eczema. So it's like this triad. And these are the people most likely to develop eczema in their lifetime. What else is important to note? That about 20% of children in general experience eczema at some point in their lifetime. And 80% of people who have eczema in their lifetime will experience it before the age of 6. So it's not typical to be 30 and starting your first flare of eczema, although it could happen. It's unlikely. It's more likely to affect infants, toddlers, and just children in general. What are the causes of eczema? Number one is genetic, so things that we unfortunately cannot change. And number two is environmental. Environmental factors could include things like detergents, soaps, humidity, temperature changes, material. These are environmental things that we could often work on in order to help control eczema. Now, what is a typical flare of eczema? It's a condition that is in remission or relapsing. So you either have a flare or it's in control and you have no flare. So that's typical for people. Some people live with it chronically long term, and that's just because it's poorly controlled, because there generally is good treatment out there, even if it requires seeing a dermatologist and taking oral steroids or hospitalization in the worst case scenario. But the majority of people have flares that will remit and then come back and forth. Now, how does it present in infants versus toddlers? An infant is likely to have it on their scalp, so we say cradle cap or seborrheic dermatitis, which is like dry, flaky skin on their scalp. They will have it on their cheeks, and they'll have it often on the dorsum of their hands. Why? Because they often suck their hands or their fingers, especially at the beginning of life. That's infants. As for toddlers, they're crawling, they're learning to move. They'll often get it on their extensor surfaces, so their elbows, their knees, things like that. Now, why would we treat eczema? Why does it matter that it's treated or not? Multiple reasons. Number one, and I'll say maybe the most important, are the psychological effects. Someone who's constantly itching and uncomfortable is not going to be comfortable to live their fullest life, to be out in public, to go to events, if their main concern is this itch and rash. People, because of aesthetic reasons, won't be comfortable, visibly having this out there. So psychological factors are important and not to be ignored. Number two is the risk of infection. So a surinfection or a super infection over someone's eczema could be like staphylococcus. Staphylococcus infection happens often in kids, and it looks like this, and it needs antibiotic treatment. The next thing is eczema herpeticum, or basically a viral breakout of the skin caused by herpes simplex virus 1 or 2 most often. And again, that's a super infection of the eczema that could be avoided. And the final reason would be for long-term scarring. So people who have this itch scratch cycle, which is what eczema basically is, can ruin the barrier of their skin, and I'm pointing here just because adults tend to have it on their elbows, and cause scarring long term, which again can contribute to psychological factors and effects, making us very uncomfortable to expose our skin. Okay, so now for the treatment. Like I promised you from the beginning, I'm also going to be linking in my description the moisturizers that I'm mentioning. We're going to start with lifestyle changes, things that you can change in your environment. So number one, we're going to talk about clothing. So specifically for kids, wash your clothes before you put it on them. Number two, try to wear cotton clothing over things like wool. It's less irritating. Number three, use a non-fragrance everything, meaning detergents, meaning creams. Try not to put any perfume on them, because eczema tends to react or flare to things like fragrances. So fragrance free is what we're looking for, both in laundry detergents, creams, etc. When we're looking for soaps for kids, look for sensitive skin or fragrance free. The other thing is obviously don't scratch. Easy to say, hard to do. So what I suggest to people is if you feel a scratch, instead of scratching it, put a thick emollient cream on it so you kind of avoid it and you're moisturizing that skin, which is so dry and requires hydration, and it's only, appeased by an itch. Cream tends to end that itch scratch cycle. And then finally, bath time. Bath time is super important. Kids can take a bath often, every day, every second day, depending on their age, if they're in school, if they're exposed to things and people or not. But we want to make the bath less than 10 minutes long, and we want it to make lukewarm water. So a very hot bath is going to dry out a kid's skin or anyone's skin, but lukewarm or just warm bath is going to less likely do that. Now we're going to talk about ingredients for treatment. So non-prescription, again, someone with severe eczema to whom moisturizers they're not responding to moisturizers, may need corticosteroids, either topical most often, oral, or something else like UV phototherapy. There are other options generally treated by a dermatologist, but for the bread and butter common flare that kids tend to have, these emollients are going to be very effective. So a moisturizer which is not perfumed, which is an emollient, is going to help maintain hydration. All we want to do is maintain the skin's barrier, because with this itch scratch cycle, we're ruining the skin barrier. Eczema does that, and when we're replenishing the barrier, we're kind of helping it build its blocks back. So ingredients we're going to look for are colloids, are ceramides, things like that. I'm going to link quite a few for you guys that you can use. The other thing is to use them regularly, every time we're washing, every time we're bathing, every time we're cleaning our hands, to apply them. Also, apply them on wet skin right after the bath rather than drying our skin and then applying it. It'll help the moisturizer work more effectively. Again, you can use it multiple times a day. It's encouraged, specifically when kids go outside, especially if you're in a drier or colder climate. You want to apply it multiple times. Next, I would say not to rub your skin when you're drying. This goes more with the lifestyle changes, but I just thought of it as you're applying cream after a bath. Don't rub them dry, but pat them dry and then apply the moisturizer. And then most importantly would be to continue the moisturizing even when there's no flare. So even when the skin looks nice and intact and not broken through, it's super important to continue moisturizing, because this is going to help prevent a future flare-up of the eczema, if that makes any sense. So that's the main stuff I had to teach you guys today. Again, there are always other options. If these are not working, a dermatologist or a family doctor or another specialist should be able to help you. Many prescription medication I'm not going to get into in today's video, but I hope the ones that I've suggested do help you. If they have, please consider subscribing to this channel and liking this video or sharing it with someone who you know suffers from eczema. Again, it's the #1 most inflammatory skin condition in the world, so it's pretty significant, and that's about it. I hope you guys have a wonderful rest of your day and look out for another video.